welcome to Live from Bed.
Thank you for having me. I'm so happy to get to talk.
We're going to call this episode Live from Crib. It's actually because I'm 20 weeks pregnant.
Congratulations.
Thank you. This conversation could not have come at a better time. When you popped up on my screen, I was just like, I actually did not introduce myself because I was like, we actually already know each other. Like you are in my inbox. You are on my phone all the time. I just follow everything that you say. And I've never had more questions than I have in the past 20 weeks.
Yes, and you're not expecting them because you don't know what they are, and it's just like it's an endless series of questions. At least that was my experience.
Yeah, and I feel like me and my husband were like, okay, it was so funny because for the first, even up until now, we were like, okay, after this appointment, we'll be calm. After this appointment, we're in the clear. No, you just never stop worrying, never stop wondering, am I doing this right? Are they doing it right? What's going on? So I'm just so excited to talk to you, as are everyone that I've told that I was interviewing you is like, okay, please ask her this, ask her this, ask her this. So I have a lot of my questions than other people's questions.
Amazing. I can't wait.
I'm like, first of all, will my nipples ever return to their normal size? No, but actually, no.
Maybe.
For real? No, are you serious?
Changes to your breasts do generally persist in some form forever, but it probably isn't the same set of problems you're having now.
Okay, because it's so that the baby can find my nipple in a dark alley. Is that the issue? Is that why they're what is happening?
There are a lot of hormonal changes during pregnancy, and the changes in the ratios of progesterone to estrogen are potentially changing your nipple size. And then they will change again later in pregnancy when you start getting ready for breastfeeding. They could get smaller. And then over time, after you're done breastfeeding, there might be some persistent changes.
I love how you say persistent changes. I have seen those on Friends. It's dark. It can get really scary.
I will just reveal that I just finally, my kids are 10 and 14, and just last week, I finally admitted that I am not a B cup anymore. I'm an A cup, and I bought new bras. But I mean, it has been a solid decade of the wrong bra size, just because I couldn't admit it.
It's an identity crisis because I was like a small boobed girl my whole life. I dressed as such, whatever. I did not know the burden that large boob, well-endowed women faced in silence.
Totally. No, it's a change. Yeah. You need more support.
I mean, I've been in the same bra. I have bras that I've had since 7th grade. You know what I mean? I've been.
Well, I get new ones. That's what I think. This underwear and bras, those are a lifetime investment.
Yeah. And I'm like, now I don't even know what size I am. I'm just ordering a bunch of shit online and we're just going to see what happens. First of all, if someone were to get a boob job after their first pregnancy or before their pregnancy, can you breastfeed with a boob job?
Maybe. So with a breast reduction, it's less likely because it's more likely that you would lose some of the glands that would breastfeed. With breast implants, the glands may persist, but again, because it's a surgery, it could interfere. So generally, people will wait, partly because then you sort of see where the breasts settle down. And you can choose your long-term size if that's the direction you're going.
Okay, so we'll procreate, then we'll fix whatever's been wrecked.
Babies first, boobs second, yes.
Okay, great. That's a great motto. Okay, so first of all, how sick of talking about Tylenol are you?
I have been talking a lot about Tylenol, but I also think that one of the main things that I want to do in my life is make people more relaxed about the things that they're doing. And so in some sense, it feels like I've been talking about this for 2 weeks and I keep saying the same things, but also if people need to hear them, then I am delighted to be able to say them.
I'd stop you at the supermarket. I'd be like, excuse me, is this okay? What's happening? So it's been haunting me. So I took Tylenol 3 times in my first trimester. Can I tell you what I think the issue is before we get into the actual Tylenol? Because I would love you to give me a quick answer on that. We won't waste all of our time there. But I think in general, how I'm approaching pregnancy. So I have a coffee right next to me right now. I have my one a day, whatever. I'm doing all the wonderful things. I deserve a prize. But there are certain things I'm not doing, right? I'm not drinking Diet Coke or whatever, which is my life's blood. That's a big sacrifice for me. I just read somewhere, it rubbed me the wrong way, whatever. My concern is I think it's more so just like women's and especially mothers' tendency to blame ourselves when anything goes wrong. It's like, if God forbid my kid comes out in a certain way, something's wrong, has a defect, blah, blah, blah. I'm like, no, I've never knocked wood more also in my pregnancy. I never did that before. I'm like a crazy person. I'm like, all day long. Anyway, it's more so that I'm like, I will blame the one Diet Coke I had in pregnancy on whatever's wrong with the baby. Is that like what most of your like or
I
most
think
people feel?
I think that's a very common pathology, and I think it is a reason. It is both a reason why people will sort of choose particular things to avoid, even if they're not exactly sure that that's really what the evidence supports. I also think it's part of why doctors will and other people will tell pregnant women, like, just avoid this, because of course it's like, even if there isn't really good evidence, what if something did happen? You wouldn't want to blame yourself. I think where I struggle with that and where I think it's tricky is, there will be a time with your kid when something does not go the way that you hope. Right. Not hopefully not something big, very unlikely to be something big, but there's going to be a moment when like they have an enormous tantrum or they have some behavioral issue, they have like, it's just like stuff happens. We don't have that much control over our kids. There's a lot of randomness. And I worry that this kind of thinking leads people to where they will definitely blame themselves. They'll be looking in the past, like, well, what was it that I didn't do? Was it this coffee? Was it like, and if we can start from a point of, actually there isn't evidence that these things are bad, then when we get to that point, it's easier to say, just sometimes things happen that are not good and they aren't my fault. But if we've sort of adopted this idea that it's our fault, then later when the inevitable things happen that, our kid doesn't get into Yale, it's like, oh, that's probably because of the one Diet Coke or whatever that I had.
No, exactly. And like, that's the scary thing is it starts from, it starts before conception. You're like, oh, like I want to have a baby in 6 months. So like, I'm going to change this about my life and da-da-da. The call is not only coming from inside the house. It's like everyone around you is also judging you and taking their anxieties and putting them on you. And it is like you're lost in the sea of like risk versus judgment and opinion. It's like what's real, what's right, and you just so badly want to do it right, and there isn't necessarily a right.
Nope.
It's so hard.
Yeah, and there feels like the messaging is sort of every moment is an opportunity to mess up, and everything is very fraught, and every action that you take has tremendous importance and consequence. Yeah. And in some ways, I think it's hard to accept, but like most of what you do doesn't matter. And this is going to happen when you have a kid also. Like there are some core things that, you want your kid to have a stable place to sleep and enough to eat and someone to love them and, some books to read, some basic stuff. But most of the things you are going to obsess about don't matter.
I hate that.
And that's just what it is. That's just what it is. And it's
I hate
like
that and love that.
I'm sorry. It's like you should, it's a glass half full, glass half empty. Like, you can make a spreadsheet and rotate the Montessori toys as much as you want, and it is not going to matter for one hot second.
What I've learned through this process is like, unless it's you or my doctor, like, I just want to relate. Just like, tell me about the hemorrhoids, the constipation, like the sex dreams you're having. And like, don't tell me what I should do, what I'll need. I've had people nearly bang the door down of my house or whatever because I'm not having 24-hour care. I'm like, you know what I mean? Like, or like stupid things like that. Or like, I'm deciding to do this or I'm deciding to do. It's like people give such a shit about what you do. And let me tell you, people think they have one baby. They are the expert on fucking everything. It's crazy. It drives me nuts.
What's amazing is then you have the second baby and you're like, oh man, I am not. And it turns out all of those great techniques. I mean, I thought I was such a good, my first kid, I was like, you don't need discipline procedures. Like you just ask them nicely not to touch the stove. And they're like, oh, I'm so sorry. I won't touch the stove again. And then I had another kid and I was like, oh, just kidding. That was
You're like, we do not negotiate with terrorists. Exactly.
It's like this person's like living in the stove now.
Right. And my mom wrote a pregnancy book. She wrote like The Girlfriend's Guide to Pregnancy. And so I'm like, I have her, like, I love her book because it's like relating and it's, she is not a doctor. She doesn't know like everything, but she just wrote from her experience. And I just feel like we need to write from our experience unless you're you. So that's why I'm going to pick your brain because you actually know the data, the research, the non-alarmist way to approach this very alarmist environment that is pregnancy. There is dynamite everywhere. Like, I'm like,
Everywhere.
oh, I say one thing, I'm like, oh shit, I really offended this group of people. You're just, it's nuts. So you just don't know if you're doing it right. So let's just start with the Tylenol. Just give me a quick and dirty. How do you feel?
So there are some correlational studies where they look at moms who take, actually, it's typically in those studies, it's quite a lot of Tylenol. It's like, so take Tylenol or acetaminophen more than 28 days during pregnancy.
Okay.
And the babies are at a slightly increased risk of autism later. The problem is that the moms who are taking Tylenol more are different in many other ways than the ones who are not. Some of which may themselves actually be sort of maternal neurodivergence, for example, or just there are other things potentially going on. The best studies of this are ones that compare siblings. So you have two siblings, same mom, Tylenol exposure during one pregnancy and not during the other. And that helps you isolate things that are not about differences across moms. And when we look at those studies, we don't see any link with autism. So basically, the best evidence does not show a link here. And this is an important place where we're distinguishing between, like, there is some evidence, and that's why people are saying this, but the best evidence doesn't show it. And so if you have and there are, just to be clear, reasons to take Tylenol during pregnancy, like pain relief, but also fever reduction. And fevers themselves are dangerous. So there's like a whole other side of this.
Yeah. So I feel like the common conversation in pregnancy is about autism and how to prevent it and where does it come from and what's, so like that is, I feel like, everyone's fear because it's a spectrum, it's so confusing. There's so many different kinds. There's so many, I don't know, it just feels like all of these studies are relatively new and no one tests on pregnant people. And it's scary. Like, even for me, I'm like, and I was reading TikTok, and not to diminish or like, make it sound silly, but all the comments were like, oh yeah, it was the Tylenol, not like my husband's inability to like hear fireworks or like, or like memorization of a song when they hear it one time, like, I feel like it is largely hereditary. No?
Yeah, the genetic components of autism are very, very strong. So the sort of heritability is something like 80 to 90%. And then, people are like, well, why has it gone up so much over time? And the answer to that is mostly diagnosis, mostly that we are catching sort of more mild cases of autism, which previously would not have been diagnosed or would have been categorized in some other way. There's a lot of stuff going on in that space, but one of those things is not Tylenol.
Interesting. Okay. So like, theoretically, you shouldn't take it every day of your pregnancy. You probably shouldn't take anything necessarily every day. I mean, some people are on antidepressants, some people are on other things. Yeah,
I mean, I think there, the rule of like you should take medications when you need them is a reasonable one. And so I don't think anyone would say to anyone, pregnant or not, like you should take Tylenol as, like, it's not a vitamin. Like it's a treatment for a set of symptoms. If you're experiencing pain or fever, this is the best treatment that we have during pregnancy for that, and you should feel comfortable taking it.
Okay, so that brings me to, we got a lot of mentally ill queens that listen to this show. I am one myself. I went off Lexapro just because I thought I'd like try like a new risky personality. And things have been fine, thank God. So I'm not on an antidepressant right now, but I have been historically. And I know some people need an antidepressant or an SSRI or any of those things. Is that one size fits all, or is that kind of case by case?
So generally, when we look at antidepressants in pregnancy, this is framed, I think, appropriately as kind of a cost-benefit analysis.
Mm-hmm.
We don't have perfect data on this. There is, maybe a little bit of a risk of bleeding kind of later in at birth with people who are on antidepressants. That's something, generally we can deal with, but is worth being aware of. Mm-hmm. But the things a lot of people are concerned about, which is like, here is a really big danger for the baby, those don't show up much in the data. And so I always tell people, like, there are good reasons to stay on your SSRI, mm-hmm. and it is something you should talk to your doctor about and think about, how do we think for real about the possible risks and for real about the benefits, and how do we trade those off? And for some people, they're on a very low dose and they say, let's try going off and see how I feel. But there should always then be on the other side of that, like, if that doesn't work, you should go back on it, right? Totally. Like this. and then there are people who will say, you know, I know that I can't go off this. Like, this is something I need for my mental health. And then the cost benefit goes in a different direction. It's like, you know, it's like many things. There's no perfect solution here. You got to figure out what's going to work for you and what prioritizes your health broadly, not just this one tiny component.
Right. And 9 months is, you know, a long time. You got to figure out like, how you're going to live your life. Yeah. I'm learning that every day. I'm like, I'm going to be pregnant forever. This is great.
It's like forever. Yeah. You got like a lot more weeks, many more weeks.
Is mental illness hereditary?
Yeah.
In general? It is.
Almost everything has a genetic component. And, you know, some have more important genetic components than others.
Yeah. Okay. I like to think of it like a hallway of like light switches. And it's like sometimes like everyone's got like if depending on your genetics, you have like certain light switches, but then like some things in your environment or nurture or upbringing or circumstances can like trigger those light switches.
Totally. That's a really nice way to think about it. Yeah. Almost everything has a sort of genetic environmental component. I mean, there are you know, there are a small number of genetic things where it's like if you have this gene, you get this disease for sure. But most of our genes, or many of them, have sort of complex interactions or things in the environment that might turn them on or not on. Okay.
Yeah, I feel like that. Okay, so my husband is sick because he does not have the same relationship to germs that I do. He does not understand that that they're everywhere and how they go from one place to the next. It's fine. We love each other. It's really great. But I am like, I do not like getting sick. I am no hero when I'm sick. I make it everyone's problem. It's not cute. But then being pregnant, I'm like, very nervous about getting sick. So like, can I catch a cold? Can I catch the flu? Can I catch RSV? Can I catch COVID? And will my kid be fine?
Yes. There are a couple of viral illnesses that you want to be more careful about during pregnancy, although it's unfortunately, it's a bit hard to avoid, but there's something called CMV, cytomegalovirus, which you are at relatively low risk of because you don't have a toddler. But if you're with your second kid, it's something that can lead to hearing loss in the baby. So that is a virus that people want to try to be cautious about. It's a standard respiratory virus, so it's a bit hard to avoid. I realize this is more scary.
God.
I know.
My kid's
I'm sorry.
never going to school. My toddler's never going to school when I'm pregnant with my next. Okay, great.
That's not the right reaction. We can talk about it with the next kid. But the things you have listed, RSV, COVID, the flu, you want to get a flu shot because flu can be more serious during pregnancy. The reasons to get an RSV shot or a COVID shot actually are more to protect your baby. So as you get closer to delivery, those are like good options to pass on antibodies. But if you get COVID or RSV during pregnancy, you're unlikely to notice it in a significant. I mean, it's just gonna be a cold.
You're just gonna feel like shit.
You're just gonna feel like crap, like you normally do.
Yeah. Okay. Exactly. But if I do get the flu, what then?
It's just that the flu can be more dangerous for pregnant. You're like I think you think of yourself as like a little bit immune compromised, and the flu can be pretty bad, and so that's why we tend to prioritize pregnant women for flu shots.
Okay, if I'm Rh negative, which I am, am I more immunocompromised?
No, that's a separate thing.
Okay, great. You know, these doctors, they rush you in and out of the appointment. You don't have much time to ask these questions.
No,
I'm like,
that's a totally different. That's a different thing, which you may have to deal with, but is not about immunity.
Okay, so if I had RSV like 2 years ago, and let me tell you, I saw Christ himself when I had RSV. It was the worst sick I've ever been in my life. It was awful. Do I still have like antibodies, or like can I? No.
You could get it again. People can get it pretty much they wane pretty extensively over time. So you could get it again.
And then the baby, if I got the shot, would get the antibodies.
Or if you have RSV. Okay, so if you get RSV, you can pass on the antibodies to the baby. If you get the shot, you also pass the antibodies.
Okay. So then TikTok have really freaked me out because there's the whole like, don't let anyone kiss your baby when they're born. How do you feel about that?
There are very good reasons people are saying two different things on that. And so let me tell you the thing I definitely think is true, and then we can talk about the second one. So I think the first one is, avoiding germ exposure with a very young infant. So before your baby is about 8 weeks old, if they get a fever for any reason, they are going to need a spinal tap at the hospital. This is a very common procedure, but as you can imagine, it is a spinal tap, as I have said, and it is not a thing that you want. And the reason we do that, there's a good reason we do that, which is that small infants are at higher risk for bacterial infection. They want to make sure that they don't have that. But it means like if your mother-in-law comes over and has a little bit of a cold and she passes the cold onto your 2-week-old and they get a fever, they're going to need a spinal tap even though it was your mother-in-law's cold. So
oh my God.
For those reasons, we want to be like quite careful about sick visitors in the first several weeks. And just in general, you shouldn't have sick people in your house. And certainly like having people like, lick your baby's face, kiss your baby's face, whatever. It's like good to avoid that. There's then this second issue, which is like don't kiss the baby because of herpes, which that is a way that herpes can spread. I think that is like a much lower risk
I'm sorry, I'm like laughing because I'm literally like, if someone gave my fucking baby herpes, I would murder them.
Right. So if someone has, it's perfect. I should just say, it's perfectly fine to just tell people don't kiss the baby's face.
Yeah.
Like these are your boundaries. If you don't want people to kiss the baby's face, just be like, don't kiss my baby's face. And then if they're like, oh, I love kissing the baby's face, you'd be like, sorry, don't kiss the baby's face.
Right.
You don't have to explain why. You don't have to say it's because I think you might have herpes. You just be like, we're not doing that.
A cold sore that looks questionable.
Yeah. Just be like, you know what? Like we're not doing that. That's the rule. You'd be like, Emily said we're not doing that. They'd be like, who's Emily? It's like, don't worry about it. Any explanation is fine. It's my boundary.
Exactly. No, it is like, that's the thing is like, you really do make me feel better. But at the end of the day, it's like there are fucking like threats everywhere. It feels like it's hard to navigate. It really, really is. I was going to ask you, like, I feel like with like every decision, like from sleep training to screen time to kissing babies, it's like everything is like a mixture of feeling moralized or like an actual threat or issue. What's real and what's not, like how do you help people decipher risk or judgment?
Okay. So I think the first thing, and this is the most important distinction between my first kid and my second kid. I often, like when I wrote Cribsheet, which is my book about like little kid parenting, I would never have been able to write that with my first kid because when I had my first kid, everything that happened was like a moral crisis panic at 1,000%. Like, my mom told me, I've told the story before, but like one time when my mom first visited, we had mittens on my kids' hands because it was like, I don't know, they like give them those so they don't scratch their faces. Yeah. And she told me, if you have her wear mittens, she'll never learn to use her hands. Okay? Which like, now that I think about it, like is just the stupidest thing. Like, what do you mean? What? But at the time, I was so, like, that freaked me out so much. It was just like, yet another thing. It's either scratches on her face or she'll never learn to use her hands. And I guess I'm choosing between, like, a terribly scarred baby and a baby with, like, no hand. Like, these are my only choices, And, and I think with the second kid, one of the things that was such a big change with the second kid was you can't worry about that stuff because you also have a toddler. And you're just like, what do you mean? It learned to use its hands. Don't think about it. But it helped me really isolate kind of here are the core decisions. Like there are some really important things you have to decide. Like, are you going to breastfeed or not? At some point, you'll have to decide if you're going to sleep train. You're going to need to decide like where the baby's going to sleep. You're going to need to decide what kind of childcare. There's like some core decisions. And if you kind of like focus on those and try to like use your energy on like, I'm going to think about this decision. I'm going to decide what's right for me. And then I'm going to move on. And you sort of accept everything else you're doing around that is like not actually that, like there's many good choices. You just kind of do what's easiest.
Yeah. Like, okay, so I want to talk to you about like what comes to mind for me so much is one of the bigger decisions that I'm hyper fixated on, especially at 3 a.m. when I can't sleep. Why can't I sleep?
It's because you're on. Yeah, it's just because of the baby moving around.
It's crazy. I thought I'd hibernate for 9 months. I'm it's like it's crazy. Anyway, so I'm always thinking about the circumcision, right? Because I'm growing a penis in real time. I'm having a boy.
Nice.
But like, do they interpret pain in the same way? Like, is he going to be traumatized from that day on?
Okay.
Yes.
Yeah, in some ways, I like where you're coming in from this because I think that the decision of whether to circumcise or not is almost always made for like personal and cultural reasons.
Right.
And that is good in the sense that, there are some small benefits, And of course, there's some small risk, but like basically these kind of wash out. So I think most of the decision for people should be like, I'm either going to do it or not because, my family does it or we're not going to do it. And like, that's done.
Yeah.
But then you're focused on, okay, like what are the circumstances I want here?
Yes.
So traditionally circumcision was performed without pain relief. The sort of traditional like brisk circumcision is with wine.
Yeah.
Sorry. Give me one.
No, I want to choke too.
That's not why. That's why I was coughing.
Yeah.
But it has become clear over time that infants do experience pain with this procedure. People used to literally think like newborns couldn't experience pain.
Yeah.
That's not true. And there are better pain relief options. So you can there's a thing called a nerve block. Basically, you can inject lidocaine into the base of the penis, and then the pain is lower. And a combination of like injected lidocaine and like sugar water seems to be the sort of best pain relief option. And so, that is tricky if you're going to do this in a hospital. They should offer that, or at least you can ask for it. If you're going to do this traditionally, it's less obvious it would be an option, but I would still ask for it because we do have a little bit of evidence that infants that are circumcised without pain relief do show like more extensive responses to the pain of vaccination later. So not that it's linked to like all these claims, like it's linked to autism. It's like that stuff doesn't show up in the data, but but this is a painful experience. And if we can provide pain relief, that's probably a good idea.
Yeah, I mean, like they have the restraints, they're cold, there's a lot of things going on. And so like, but is there a difference between day 2 in the hospital getting snipped or day 8?
There are differences if you're going to do it when your kid is like 2 years old. That's a much more significant procedure. You generally have to go under a general anesthesia because it's like freaks people out too much. But no, day 2, day 8, that's all in the same range of this stuff.
Okay. Oh my God. I mean, yeah. So I feel like I just have to find a doctor that can do like take every pain measure and can offer me all that full buffet.
You want the buffet, like the sort of optimal thing in the literature is like the buffet of pain measures.
Yes. And like a shot in the base of the penis, that's got to hurt too.
Yeah, those are like a little they do in the buffet.
Yeah.
They do like a topical, then they shot, then they.
I've had that topical bullshit. It doesn't do anything. I feel like we go for the full Monty.
No, you want the full Monty, but you do the topical for the shot, and then you do the full.
Sure. Okay.
Yeah, you want the full. No, for sure. I just had things that are coming for you later. My one of my kids, their earring like got pulled into their earlobe by their hair. And God. So we had to have it like pulled out. And for that, you get the like topical and then the shot.
Oh my God. Yeah. I mean, the thing is like, fuck that book, The Body Keeps the Score. Like I mean, thank God but that's just like in my mind, like over and over and over again, like the body keeps the score, body keeps the score. But like, is it true that I need to just like breastfeed or like just do skin on skin, like immediately after? Like, does that help with pain for them?
The main thing that helps with pain is a pain numbing solution.
Right.
But they do sometimes in the buffet of pain relief for circumcision, you will often either breastfeed or give them some oral sugar.
Yeah.
While you are like getting ready, you'll numb it and then you cut it. And that's the buffet of pain relief.
So drinking while you're pregnant, how do you feel?
You should not drink a lot while you're pregnant. There's very clear evidence that binge drinking and heavy drinking is dangerous. The evidence around occasional light drinking doesn't really show up in terms of negative impacts. And so occasional alcohol consumption during pregnancy, I think the data does not suggest is dangerous.
Okay, so
but not everyone's going to choose. Like, not everyone's going to choose to do this, but
yeah, I just care more about Diet Coke. Like, that's a bigger sacrifice for me. So I'm like, fuck the wine. I don't care.
Why you're not having Diet Coke?
Yeah, oh, really? Oh my God, bless you. You could set me free. I just read on some hippy dippy site that it's like it's going to cause autism, as is me breathing air. So
no, these things are all correlational, not causation. I really think you should feel fine having Diet Coke.
Really?
Yeah.
I'm like, my mom definitely had Diet Coke. But the thing is like, when our parents are like, oh, I had this, it was so different. Like the food with Tide, like, detergent was different. Like all of that was different.
Yes. And there are things we have learned over time. And then there are things where I think that our kind of that we are excessively neurotic and excessively cautious. So, and it's sometimes hard to separate those things, right? So like when you have a baby, your mom's going to be like, I always put you to sleep on your stomach. And it's like, yes, that's true. But we have very clear evidence that putting your baby to sleep on their back is safe. And then there are things which are like, well, you know, I had Diet Coke where it's like, yeah, actually, that's fine.
Okay. So is there anything that you are like, do not do? I mean, like maybe like smoking crack.
Smoking.
Do you smoke crack?
Smoking, I don't, not
Period.
frequently.
No, just in general, just one smoke crack. Like, I don't know how you ingest crack.
No, one should not do that. That's not good.
Okay.
That is
so
how you consume it, though.
And okay, thank you. And smoking in general, like just no. Smoking weed.
I think smoking in general, no. Marijuana consumption during pregnancy, I think no. Actually, the evidence on cigarettes is much stronger as a negative than the evidence on cannabis, but still, I think that's like we're starting to get some evidence to suggest it's probably not a good idea unless you're using it as a treatment for hyperemesis, where it's a more complicated trade-off.
I did see that somewhere.
But yeah, don't smoke, don't do drugs, don't binge drink.
Okay, binge drinking is just for those people out there. Like, is that like 5 drinks? Is that 2 drinks?
Yeah, 4 or 5 drinks. And I think in general, like a drink at a time.
Yeah. Okay, great. Fantastic. Okay, so what about when you're breastfeeding? Can you drink while you're breastfeeding?
Yes.
Can you smoke weed when you're breastfeeding?
Okay, so let's start with alcohol during breastfeeding because I think people get confused. And what's great about breastfeeding is that you know how the baby is being exposed, right? So what's hard about some of these things in pregnancy is we're sort of inferring from like later, but we don't exactly know how, like,
Totally.
We don't exactly know how the baby's exposed, how much passes through the placenta and so on. When you're breastfeeding, like if you want to know what's the baby getting, you just like test the milk.
Oh.
And so when you drink, you get some alcohol in your bloodstream and it also goes into your milk, but it's in the milk at the level it's in the bloodstream. So it's not like your blood is not the same alcohol level as the wine. Your blood alcohol level is very low, which means that the alcohol level in your breast milk is like similar to the alcohol content. Like even if you've had like 4 tequila shots in an hour, the alcohol content is like what you get in a glass of orange juice, basically.
Okay.
Because anything with fermentation has some alcohol. So basically, it is fine to drink while you're breastfeeding.
I've heard that the best time to drink is while you're breastfeeding. Where did that come from?
I think that came from the idea that then you would like have a low level of concentration while you were breastfeeding, and then it would sort of rise later, but you don't need to do that.
Okay. And so, but weed smoking is different.
Weed smoking is different because it persists in the bloodstream for longer. And you are, because it persists for longer and the half-life is longer. And
so
generally,
that would go into the baby, theoretically.
Yes. If you are choosing to use weed, to smoke weed or to use gummies, generally like waiting 5 to 10 hours before you breastfeed is recommended. And for most people, that would mean, pumping and dumping or something like that.
Right. What about fillers, Botox during pregnancy and while breastfeeding?
So, okay. For both Botox and fillers, they are not likely to do it during pregnancy, even though there is actually no real reason not to. In the case of Botox, we actually have people who have gotten botulism poisoning, and it turns out that's not bad for your baby. It's not good for you. But there's sort of no reason to be worried about this during pregnancy, but no one's going to do it for you. During breastfeeding, it does not pass through in meaningful amounts to the breast milk. So if you want to get your Botox done while you're breastfeeding, it's fine.
Okay, filler too,
fillers.
same kind of thing?
Yeah, and your fillers also, same kind of thing.
Okay, wow, great, thank goodness. Because let me tell you, I won't do it while I'm pregnant, but after I'd like the option, you know what I mean? I'm like...
I don't know I am terrified at the idea of tiny needles in my face. And so although this is by far the most popular question on my Instagram, I have never had Botox.
Yeah, we're like, we've never felt uglier. So just tell me when we can go back.
I think I'm like the wrong age. It's like the people like a decade. I missed Botox by a decade or something.
Totally.
And so I'm just like, I'm too old. It's all ruined anyway. So I'm not getting in there with,
Okay, so I am planning on eating my placenta in some fashion.
Jesus Christ. Okay. Okay.
How do you feel about that? Should I mean, you know what I mean? I'm just like, I'm trying to fight. I don't know what I'm trying to do. I'm just trying to, it's the only natural thing I'm going to do. I'm like, give me an epidural and then I'll eat my placenta. I'm going to do it in like a pill. So like, it's not
Oh,
going
you're
to be
not gonna
like
like
grilled.
cook it with
No,
like a liver with like a nice
no,
side of
no, no, no,
Chianti? No. Mm-hmm.
no. I'm gonna, humane way just of eating it in a pill. Does that
Mm-hmm.
do anything?
Nope. No.
Really?
No. 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 We have no evidence that consuming your placenta in any way improves anything about anything.
Wow.
And you
Because you
definitely
know why
want to
I'm
be,
really doing it?
you do want to be careful because like this is a medical product. And
Right.
so, like, just if you're going to do this, which I don't think is a good idea, I just want to crystal clear tell you I don't think it's a good idea. Make sure that you've got like a reputable person producing your placenta pills,
No, I think
because
it's literally like placentapickup.com and they're going to come into my hospital room and
fun.
it's like a
Okay,
vampire. No, can I tell you why I'm doing it straight up?
please, yes,
Because I saw my dog give birth and she ate her when I was like 8 and she ate her placenta.
yeah. A lot of
And I was
mammals eat
like,
their placenta.
yeah, why do they
Yeah.
do that?
Because if you are if you're in a resource poor environment where you might not be able to get enough food because you're scavenging on the plains, then there might be value to consuming this placenta because it has like blood and iron.
Nutrients.
But
Right.
where you can get iron is like Whole Foods or other
Sure.
other
Marijuana.
like Grubhub. I don't know if you're aware
Right.
of DoorDash, which could also deliver sufficient
some iron.
calories.
Yeah.
Exactly.
Okay.
So
Wonderful.
anyway,
Okay, so no need to eat my placenta.
no need to eat your placenta. No need to eat your placenta.
Okay. Okay, that is fascinating to me. Okay, so also I decided to start. I'm like on a prenatal that I have to take 8 a day, which is like just sadistic and awful. It's horrific. No,
amazing.
it's truly. It's like it's hell on earth. If I miss a couple doses, like, do I really have to take this every single day and postpartum?
Generally, for so okay, let's sort of two things. So when in your prenatal, what we're really looking for is either folic acid or folate.
Right.
Probably some DHA, iron, maybe some vitamin C to help the iron absorption. Those are kind of the core things. So if your prenatal has those 4 things, which like anything, including like the generic like Nature Made or whatever these like cheap versions, then that's fine. You have everything you need. Anything else that your prenatal is adding to it is almost certainly irrelevant, unless you are sort of specifically vitamin deficient, which most people are not.
Yeah.
So I'm sure, and also, of course, all of these things are a little noisy, so it isn't like you have to have exactly this amount of folic acid every day. Like,
Right.
it's a good idea to supplement because you might not get enough folate through food. And so but I wouldn't worry about it if you're taking, I'm not even sure what's in these 8 pills, but like, I definitely wouldn't stress out if you're missing the occasional
No, it's
pill
like the
or
same
day.
thing in the 8 pills. It's just like to get the full dose, you got to take 8 of them.
Why?
I don't know.
that
It
makes
just
sense.
because they don't like women. I don't know.
So I don't, this sounds
they
like a lot of
smell.
effort. Sounds like a lot
It
of
is a
effort. And
lot
they
of
smell. They
effort.
smell.
Yeah.
Yeah.
It's a lot of effort. But like if I skip it, I'm not going to like the baby's not going to come out like a
And
gargoyle.
after you really like the one thing I think people should be very careful with after is iron. So a lot of people are anemic. And so I almost always tell people like try to get an iron test. So it's really like a good idea to try to get an iron test. You probably are going to want to take iron supplements later, but the rest of the prenatal stuff is not relevant anymore.
And iron kind of becomes an issue more like later in the 2nd trimester, right?
Iron is always an issue. A huge share of women, pregnant or not, are anemic.
Yeah.
It's always a good idea to have your iron tested. Get your iron, your ferritin tested. It's it's just a good idea.
Okay, is it true, because I love to blame men, is it true that like how sick you are in pregnancy or like if you have morning sickness, all of that is because of the man?
There is a little bit of evidence, mostly no. Sorry. There actually is a little bit of evidence that for people who have preeclampsia in one pregnancy, if we get like recurrence in another pregnancy, that it's the recurrence may be lower if you have a different partner. And so
Okay.
one interpretation is that's like sort of something about the sperm. Another interpretation is like you're less stressed out because, and like you were very stressed out the first time. That's why you switched partners. It's like a lot to unpack there.
Yeah.
But I think most of these things about like, men are at fault for all your pregnancy symptoms are not. No.
Okay, but the gender is their fault.
They are the contributor of the X or Y chromosome. Yes.
Okay, so is it true? My father-in-law had 3 boys, and he loves to tell me that he only had male sperm. Is that true? Can some people only have one gender?
No, definitely not. There are some cases in which there are like people who are like sort of slightly, we think there are some cases in which some men produce, slightly more male sperm than female sperm, but like those effects are small, and there's no one who only does male sperm.
Okay, so I read in parent data. Do you like to say data?
I like data.
Yeah, I like data too. Okay. So in parent data, I read that in general, more men are born, right? Because like there's something in like the survival. Like, tell me about that. That's interesting.
Yeah. So at birth, the sort of naturally occurring birth rate is about 51% boys. And that is because from an evolutionary standpoint, you want there to be about equal numbers of men and women at like reproductive age.
Wow.
And boys are more likely to die all the time. All the time. Because they only have the one, it's because of stupidness and other things.
Right, anyway. Exactly. They do all start out as girls, right? Like, and then like just in conception?
Yes, and then there's a thing that the chromosomes turned on that like causes the development of male sex organs,
Okay, so is it true that if I want to have a girl next, I should have sex before my conception date? Is that whole thing true? Like timing your sex based on
The only
I
thing
can't like sit on my head. There's nothing I can do.
No, timing sex on your head. None of this stuff works to alter gender. If you really want to have a girl, the only options are like, very complicated.
Yeah. Okay. So I also heard there's like a wives' tale that like if you have kids close together, they're going to be in the same gender. That's all bullshit.
Oh yeah. Mm-hmm.
This is really bad for someone who likes to have a little control over her life.
Agreed.
Like that really is the issue. I think where's the line between informed and like being in control?
Right. No, totally. And we all want to know. You sort of have this idea that like collecting evidence or thinking about it is like going to give you control. And this happens after, I'm sure you will fall victim to this, but when people there's going to be a point in which you're like trying to collect data about your baby so you can predict like when is he sleeping, and it'll be like, oh, we left the window open like a quarter of an inch and he slept for 4 hours. And so like, let's do that every time. You're sort of like trying to see causality where it's just like babies are random.
And you probably love people like me who are like, oh, and he's a Pisces rising, so he's also not
well, because I ate the placenta. That was why it worked out like this.
I was like, I am from LA. I'm going to eat the placenta on my way to my Botox appointment, That's what I'm going to do. Okay, so I also heard someone told me that, I don't like when people yell at me in general, but I actually reject it entirely. But like in utero, like is the baby, can they cry in there? Like, do they get upset if someone's screaming at you?
Oh, no. They can hear noise. Like they can hear noise. They perceive noises, but they don't perceive them that loudly because they're like they're in water. And they don't know tone. They could perceive your stress. Like in principle, they could perceive your stress response. So like if your cortisol goes up, they could perceive it's not like a bad thing, but like they can, and similar, like if they are exposed in the amniotic fluid to like flavors of the things that you eat, which is just a kind of like an interesting fact.
Okay, but like let's say I only want to eat pasta with butter and chicken fingers my entire pregnancy. Is that bad?
No, that's totally fine.
Okay.
Yeah. You want to make sure you're getting your macros and you're getting some. Yeah, that's fine. Just eat enough calories.
Okay, because like you can't have a green juice. It's sometimes like the thought of spinach makes me want to vomit sometimes.
Right. Yeah.
So sometimes you just like that's.
I don't like spinach.
That's the only option you have. Or is it true? Everyone's like, oh, like your first baby will come late. How do you feel about that?
On average, first babies are slightly later than second babies. But it's actually a little hard to evaluate this in the current moment because there's a lot of induction and other stuff that's going to push or that's going to make those numbers hard to interpret.
Okay, so why is there so much noise around induction? I've just chosen to plug my ears to it, but like, why is everyone like hate Pitocin or judge you for getting Pitocin, or what's that all about?
So I think what happened is some people still are very afraid of the idea that if you induce labor, it's going to lead to an increased risk of C-section because people will, because of the like cascade of interventions. Okay. Then there was a study a number of years ago, which basically argued that inducing at 39 weeks did not lead to an increased risk of C-sections. And in fact, like if anything, maybe sort of slightly reduced C-sections, although it really wasn't significant, but just sort of move people away from the idea that this was a concern. And that changed practice. So many more doctors now will sort of routinely suggest or at least offer an induction at 39 weeks. But then I think we've seen the sort of other part of the pushback where people are like, well, I don't want to be induced. And like, then I feel like I'm being pressured into being induced. And so I think it's become a little bit of a like balance and some conflict around this choice.
I mean, there is not one fucking step of this shit that you can get through without, my God, like can something be straightforward for the love of G?
And I think for something like that, I think the question I would always ask is like, what is the birth experience you want? Like if you told me like my goal is I'm planning not to have an epidural, like I want to have a water birth, whatever you think. It's like you can't be induced at 39 weeks if you don't want to have an epidural, because if you get induced, you're very likely to want an epidural because the contractions that come with Pitocin are much stronger. So that's like one path. If you told me like, I really want to know exactly when this is going to happen and I'm planning to have an epidural and I'm like super comfortable like doing this, like great, ask for a 39-week induction and, get your epidural and you'll know when it's happening. And so much of this is like, rather than listening to the people who are like, just to be like, think about what is the thing that you want. And then that is going to largely determine how you want to go about getting it.
Okay, so when should you go to the hospital? If my water broke right now, God forbid, not me really, but let's say I was at full term. When, here I go knocking on wood again. When should I go to the hospital?
If your water breaks, you should go to the hospital. Most labors don't start with water breaking. But yeah, I mean, you should certainly call your doctor. Yeah, but that's not that, even though that's like what happens in the movies, in the world, it is not, that's not the most typical.
How do you know you're going into labor?
You have contractions. You start to have contractions, and then they sort of get closer and closer together. And then, like with both my kids, my water broke like basically. My son, my water broke, and he was born 3 minutes later. It was like it was like right at the end. Actually, your baby can be born inside the amniotic sac. That's not common.
Oh, so your water doesn't even have to break.
Could not break. That's very rare. But the water breaking is, if your water breaks before you go into labor, then they will often bring you in and then they will often induce you, because if you go for too long, there's a risk of infection.
I mean, good Lord, this is all just crazy, no? Like,
it is. The thing that's amazing is that like you're gonna have this like right now there's like a person in there, right? And like eventually they're gonna have a job. Yeah, and that's just like fucking like that's wild.
No, it is crazy. Like I'm going for my anatomy scan and I'm like, I can't believe we're going to see like hemispheres of the brain and the kidneys and all of that stuff. Is there a point to you? Like my doctor likes to put it in terms of like when you post on social media, right? Like, is there a point where you can exhale theoretically a little bit?
About the viability of the pregnancy?
Yes.
So after babies can certainly survive after 25 or 26 weeks. Yeah. But generally not without complications. I think once you get to like certainly like 34 weeks, I think that's a point at which things generally go very, very well. So, as you go forward, like every amount of time the baby is in there, that is good. But I'm going to tell you the honest truth, which is that like, welcome to a life where you never really exhale. Sorry.
I love exhaling.
Love it. It's like, I mean, parenting is like a thing where you're like, your heart is walking around outside of your body all the time. And it's just like it's amazing and special and spectacular, but also terrifying.
Yeah. Okay. I mean, great. So, in addition, someone freaked me out the other day because like I'm ultrasound friendly and I would like to check up on him, not excessively, but I like that. Is the ultrasound gonna make him come out
No,
like
the
ET or
ultrasound
something?
is
Like
no, the ultrasounds are okay.
they're
Ultrasounds
fine,
are a
right?
good tool. Yeah.
Okay. Okay. I'm like, can I get your number? I need to call you. No,
It's like a text me 3 o'clock in the morning.
You're like, absolutely not. Thank you. Um, okay, if I want to go travel right after my baby's born, if I'm like crazy like that, can I go to Italy 3 months after giving birth with my baby?
That's a terrible idea, but yes, I wouldn't travel before about 8 weeks because of these issues about like what happens if the baby gets sick and so on.
Right.
But if you want to take your baby and travel with them, you can. But
Okay.
it's important to remember that it's not a vacation; it's a trip, and that it's going to be very different than for some people. This works great. I will say we took our first kid when she was 4 months to Spain, and it's like a miracle that I'm still married after that. After that trip.
Yeah, I feel like that would be like time
It's just an
difference and all
absolute
that
miracle.
bullshit.
That was the closest we got to the end.
Yeah, that would be so dark. That would be really hard. Okay, so and lastly, am I going to traumatize my child by sleep training?
No, you are not. Sleep training is not going to traumatize your child. And for many people, it's a really effective way to improve the family sleep situation.
Yeah, and if he doesn't sleep, like I'm pimping out his nursery as we speak. Like, is it
Nice.
okay that he's in there? Like, I am a little like it is weird that he's inside me and then he's going to be in another room. Like, is that crazy?
I don't think that's crazy. There are some recommendations around room sharing, but I think that they're not based on very good data, and that
Yeah.
for many people, having the baby in its own room, even from early on, can work pretty well.
I think there should be a database where you can whatever, where you can search someone you don't like or don't want your kid to be like, and just get exactly how they were parented.
That again suggests a relative level of control that I don't think that you have.
Because
I
good
do
grief.
enjoy.
Like I'm like, there's just so many places. You just have to kind of throw your hands in the air and be like, it's gonna, whatever is meant to be will meet, and I'm really honestly, like, contrary to this whole conversation, I'm really not an alarmist. Like, I'm kind of like, lackadaisical theoretically about the situation. But then you just like, if you pay attention too long, or God forbid you like read too much or are too informed, like it can get dicey out there.
Yeah, and I think it's especially hard if if information is coming at you that you're not ready for. And so
Yeah.
like the sort of most important is to be like, okay, I'm going to make a decision about I'm going to decide something about sleep training. We're going to make a plan. We're going to do our plan. And then like, you got to turn off all of the
Yeah.
like when you see, so it's like, you know what? I already did my plan. I made my plan. I did my plan. I decided what was right for me. Like, I don't need to hear what's right for you because
Right.
it was not going to be what's right for me.
I love that. That's a great place to end. Thank you
Amazing.
so much.
Thank you so much. This was
so
such a
incredible.
delight. Congratulations.
I loved this. Thank you. Please just promise me you'll come back on because I'll have so many more questions.
Absolutely.
Like
Oh my
in a
gosh,
couple
I would
months.
be delighted to. This was such a treat.
Thank you so much. So nice to meet you.